morning, everyone. Thank you for your attendance. My name is Guido Norbiato. As an endocrinologist, my interest in HIV infection began back in 1990 during a conversation with a colleague. We were working in the same hospital. He was a pioneer in fight against AIDS, and unfortunately he passed away a few days ago. He had described to me a HIV-infected patient with full Addisonian symptoms, skin pigmentation, hypotension, hypokalemia. Later, the same Addisonian phenotypes were observed in a significant number of seriously ill HIV patients. Interestingly, the laboratory exam showed that both plasma and urinary cortisol were very high, such in Cushing disease, and that the glucocorticoid receptor on the peripheral lymphomonocyte have very low sensitivity to glucocorticoids. This was associated with the spectacular production of pro-inflammatory cytokines. This condition was not tolerated by severely ill HIV patients who didn't survive. This gave us a clear idea of the connection existing between glucocorticoids, their receptor, and the immune system in AIDS disease. My research continued with success and was well received by endocrinologists, but completely ignored by infectivologists. For many years, over 30 years of research has not yet solved the complexity of HIV pathogenesis, leading to a continuous need for successful cure. Human immunodeficiency virus is responsible for about 35 billion cases and 1.5 million deaths a year. Antiretroviral therapy is very effective and improves health, increases survival, and induces rates of transmission of the virus in HIV-infected individuals. However, heart is unable to eradicate the virus completely and fully restore health. The consequence is that heart-treated HIV patients rapidly transform acute HIV infection into chronic inflammatory degenerative disease that is responsible for a number of AIDS non-related pathologies. It is believed that heart toxicity is responsible for metabolic disorders and other traditional risk factors. However, other chronic inflammatory diseases are associated with the same risk factor, even if not treated with antiviral drugs. So the drugs participate, but are not the core. Now, I want to draw your attention to adaptive system we have inherited, namely the neuroendocrine immunometabolic adaptive system. Life is organized on the basis of information programs aimed at regulating specific life processes. The system formed a tightly integrated network whose proper functioning is essential for the regulation of vital processes. Chronic stress and inflammation in HIV-infected patients attack their ability to adapt throughout their life. Let's look now at the main mechanism by which stress and non-resolved inflammation attack HIV-infected patients. First, damage the stem cells. Second, imbalance or destruction of adaptive systems. Third, impairment of the immune system function, affecting immune cell turnover, replication, exhaustion, and longevity. This is a strong attack. Dysregulation of the nuclear steroid receptor. We are speaking after of this special hormone and receptors. Activation of epigenetic mediated aberrant DNA methylation and the erosion and shortening of the telomeres. This is associated with an heightened risk of severe metabolic vascular brain disorders and premature aging of the body, of the immune system, everything. Also the stem cells became aged. Chronic inflammation damages stem cells and their regulatory effect on both innate and adaptive immune system. So the immune response appears to be mostly pro-inflammatory and thus worsen the disease and accelerate the consequence in HIV patients. Chronic inflammation induces imbalance followed by destruction of the homeostatic system. Together, such changes are responsible for the following alteration. Endocrine system disorders. Cortisol has an essential role in restraining inflammation. Neuroendocrine and immune responses cortisol is an essential role in restraining inflammatory neuroendocrine immune responses. With insulin, cortisol is the main important metabolic hormone. Changes in glucocorticoid receptor sensitivity is associated with inflammatory and metabolic disorders, as said before. Immune system disorders are chronic inflammation represents a profound stress factor for the immune system, affecting immune cell turnover, replication, exhaustion, and longevity. I repeat this because it's fundamental. Frequently, patients complain of metabolic disorders such as insulin resistance, hyperinsulinemia, hyperglycemia, hypertension, dyslipidemia, fat redistribution, diabetes, obesity. Enormous series of symptoms, of signs and symptoms, which are the index of the disease for many people, for us, because at the end. But before, there are other forces that contrast. And brain disorders. Modified glucocorticoid sensitivity has been implicated in both psychiatric and somatic disorders. Leukocyte glucocorticoid resistance is observed in the individuals with major depression and has been proposed as a pathophysiological mechanism in condition whereby dysregulated inflammation is a central feature, such as asthma, autoimmune disease, cardiovascular disease, and neuropsychiatric disease. Glucocorticoid and insulin resistance has been implicated in metabolic brain disease such as Alzheimer. Cardiovascular disorders are associated with vessel damage, clotting disorders, coronary disease, ischemia, infection, and stroke. Epigenetic alteration, DNA methylation and histone acetylation cause serious damage to nuclear steroid receptors, mainly glucocorticoid receptor, which are among the most important regulators of metabolism, inflammation, and immunity. These nucleus receptors are sited near the nucleus and regulate everything in the cells and outside the cells. Erosion and shortening of telomeres, repeated DNA sequences are associated with cancer, obesity, metabolic syndrome, type 2 diabetes, autoimmune disorders. Shortening of telomeres found in no-term ART-treated HIV-infected patients with diabetes is associated with a high risk of severe metabolic, vascular, and brain disorders and premature aging. Allora, qui. Change. This table described the complex mechanism involved in AIDS non-related disease. It's very complex, but it's not my fault. It is important to understand this. It begins here. This is synthetic flow. Here, infectious agents, sustaining low-grade inflammation that I described before. Cytokine, ROS, RNAs, microRNA. All this is important because when you take a low-grade inflammation, you have there is suppression of anti-inflammatory cytokines and stimulation of pro-inflammatory cytokines. This continues. This interferes with dendritic cell differentiation, maturation, and function, and induce cortisol resistance and insulin resistance. And you see the metabolic problems and the immunologic problems here because pro-inflammatory cytokines attack here. In consequence, there is a tissue injury, stem cells damage. Stem cells are damaged. Stem cells are everywhere, but stem cells are damaged by inflammation, chronic inflammation, not acute inflammation. When we take here I speak aberrant DNA methylation and telomerase shortening, and these are the consequences. Interfere with nuclear steroid receptor. Nuclear steroid receptors are very difficult problem in endocrinology and everywhere. You see that cos'è che è successo? Allora, when you have inflammation, an aberrant DNA methylation in telomerase is acquired, is attacked, is an attack from elsewhere and from the body and elsewhere. And this transformation interferes. There are sites of attack. The sites of attack are very frequently in AIDS patients and also in other pathologies. Glucocorticoid receptor, because steroid receptor means glucocorticoid receptor, mineralocorticoid receptor, estrogens, progesterone, androgens, retinoids, thyroid hormone, and vitamin A control. And you lose the control of this important steroids or steroids. With aging, with telomerase shortening, you have aging of stem cells, aging of immune cells, aging of the, I don't read, of severe metabolic vascular brain diseases and premature tissue aging. So you understand what happens and if you not treat and you completely destroy the virus, you have this. As is this for this reason that you have to do the maximum to kill the virus, because if not, you have a chronic degenerative disease. And the chronic degenerative disease is this complication that I speak about now. Systemic low-grade inflammation results in a widespread challenge in HIV-infected patients treated with HAART. It provides a multitude of pathological and self-perpetuating agents such as cortisol resistance, insulin resistance, nuclear steroid receptor alteration, metabolic endothelial dysfunction, stem cell disactivation, oncogenic pathway activation, alteration of evolutionary adaptive system, genetic and epigenetic, and physiological adaptive system. You have all together these things. These patients are at risk of developing a series of AIDS non-related disease, including cardiovascular disease, kidney disease, liver disease, neurocognitive disease, osteopenia, osteoporosis, and metabolic disease, including diabetes and obesity. Infected HIV patients have about 1.5-fold increased risk of myocardial infarction and higher risk of hypertension, hyperlipidemia, hyperglycemia, and type 2 diabetes, owing to the complexity of the stream integration of this system involved in chronic inflammatory disease. The problem inherent in treating and caring for this high-risk disease, which may persist for several decades, has not yet been resolved. Many treatments have been performed but they have been discontinued because of their adverse side effects. Stem cells transplantation appears promising. However, the majority of HIV-infected individuals lack any of the clinical conditions that necessitate a risk of the stem cell transplant. Furthermore, the life cycle of transplanted stem cells is brief due to their inability to maintain telomerase length during manipulation, proliferation, division, and senescence of cells. In conclusion, stem cells are fundamental to the control of inflammation and the regulation of neuroendocrine immunometabolic system, but they are in part inactivated by cells handling. What I am proposing here is a versatile therapeutic tool with stem cell stage differentiation factors obtained by zebrafish embryos. Dr. P.M. Piava at the Scientific Institute of Research and Care Multimedica, Milan, Italy, discovered and applied this therapy in cancer-based diseases. Observe now the extraordinary effect obtained obtain on stem cells expression and multipotency, cancer stem cells, cells longevity, degenerated neural cells, which can be obtained by exposure to stem cell stage differentiation factors. Exposure to SCSDF enhance stem cell expression and multipotency, enhance immunomodulatory and protective effect of mesenchymal stem cells, activate telomerase in normal and multipotent stem cells, anti-aging effect. Reverse epigenetic alteration by inhibiting DNA methyltransferases and histone acetylases. Prolong stem cell life by extending telomerase. Increases immune cells longevity, which is directly connected to the functional integrity of telomerase. Induce differentiations, slow down proliferation, and increases apoptosis of cancer stem cells. Increases differentiation and or apoptosis in degenerated neural cells. Contrast neurodegeneration in multipotency stem cells. Maintain and restores maintains and restores the homeostasis of neuroendocrine immunometabolic adaptive systems. Now I show you where SCDSF function, the point of attack of this biologic treatment is a biologic treatment. You see here, suppress, this is the past figure, the same figure, and here you find the effect of the SCDSF. They regulate and repair all these phases. It means that they do everything. You can't live without your stem cells. The stem cells are the first defense mechanism and the first control mechanism. If you have the cells that are inflammation attack also the stem cells, if your stem cells are not functioning well, they can defend you bad. So, as you see, every phase is counteracted because the fundamental of what I am telling is that you don't need one drug to combat this. You need something that attack everywhere, And this can be obtained only in humans. I repeat, if you like, because it's so important. The diagrams show the relationship within the main damages and repair resulting from the use of SCDSF. The diagram show here it rebalances anti-inflammatory and pro-inflammatory cytokines. It regulates cortisol sensitivity. It regulates insulin sensitivity. It is important for the metabolism, fundamental. It repairs stem cell damage. It repairs epigenetic alteration of nuclear receptors, mineralocorticoid, glucocorticoid, estrogen, progesterone, androgen, retinoids, thyroid hormone, vitamin D. It repairs epigenetic alteration of telomeres by inducing anti-aging effect on stem cells and other cells. He has an anti-aging effect on immune cells. The immune cells are easy to become old. Aging effect, anti-aging effect on immune cells, brain cells, and the aging of the brain cells is an important question now because Alzheimer's disease is increasing. Contrast premature aging of tissue, rebalance, equilibrate adaptive systems. The adaptive systems are important. We are born with them, which defend them us. And they are, if they are destroyed or disequilibrated, the problem, the entire body doesn't function. ASDSF prevent and treat cancer. Also notable is the majority of malignancy occurring in NARF-treated HIV-infected patients pertaining to AIDS non-related morbidities, how they are likely to be dependent on inflammation and aging, not to the virus. In conclusion, since epigenomic alterations are reversible, I am therefore proposing to harness the energy of stem cells by employing stem cell differentiation stage factors to treat inflammatory and degenerative diseases. The proposed therapy is a good promise for HIV-infected patients as it contrasts inflammation and age-associated complications that emerge as a major problem for both the current generation and those relatively young people beginning to age. Thank you for your attention.
Thank you, Professor Norbiato from Milan, for this intriguing presentation with a new therapy for suggestion for HIV. Are there any questions from the audience? Yes?
Thank you, Professor. The question I have is, you're proposing stem cell therapy.
Yes.
And you're showing that it can reverse immune, neuroendocrine, and metabolic functions.
Yes.
The question I have is, at what stage in progression of HIV
long, I don't know. I know that for many things, for many situations, the therapy is take 1 month, 1 month enough to begin to work. And is very rapid. And he attack everything. Because the first thing we can see is the brain that change. Because it's the brain influenced the first. And after the brain, because the system are colligated, you begin to influence all the other systems. The importance is that the metabolic system, the brain, the nervous system are colligated, and they can do anything without the others. If happen something that alter the sensitivity of the receptor, or attack the body, there is a rebalance of the system, because they are lived, their life, we see this vivi, and they begin to rebalance. Alors, if you attack with, you increase the immunity defense, alors everything begins. The metabolism is completely unbalanced because everything important. Is this the philosophy of this? And how we can do to attack everybody, everything? We help the body. We help the body to defend itself. So I can reply that is my opinion. Now we don't know everything, because it's very new, it's very recent. The experience on the cancer is a long time ago, but the experience of the systems, of the metabolic, etc., is new. It has 2 years. I published recently one paper, and on this, and also on the method to produce these proteins, because our proteins are amino acids, etc., taken from the stem cells, not our stem cells, because it's possible.
I know it's unrelated, but related to HIV. Would you mind commenting on the status of HIV vaccine?
No, repeat, scusi. I don't understand. Repeat. Excuse me, when I understand, I am un po' sordo.
Vaccine. My question is related to the status of vaccine for HIV.
Yes.
Would you comment on that?
The vaccine of ICD.
Where we are with the vaccine?
Early. I don't know. If you have early the vaccine, you have no complication of HIV. If you have not the vaccine, the HIV attack in this manner. And if you don't know the manner, this is the manner which attack, the main system which attack occur. And I repeat, probably now we can reestablish, for example, diabetes mellitus. Diabetes mellitus occurs, no? But it can be reestablished, a normal function of the diabetes, because the diabetes is not an insulin-dependent disease. Is insulin-dependent, cortisol-dependent, and etc. Brain-dependent disease, a complex disease, it's very complex disease. And if we take this substance, we can give this, and after you come si dice ripristinare? Restart. The mechanism of function of diabetes. The diabetes is immunology. The diabetes is lesion to the vessels. The diabetes is lesion to the heart. The diabetes is disturbance of the metabolism because every tissue use not sugar but lipids. And the translation from lipids to sugar into the cells is favored by glucocorticoids. This is completely dimenticato for good.
Thank you.
Okay, thank you, Professor. You clearly indicated that the pluripotent stem cells are very important to regenerate tissues and even the immune system whenever there's an immune deficiency virus in the body.
Yeah.
Thank you for this explanation, and I would like to present you this certificate of recognition for the work you have done as a keynote speaker for our Congress. Thank you. Again.